medical information. Since everyone's individual situation is unique, you should consult your own physician before taking any action related to your personal health. All content of this program is intended for general informational purposes only. Good morning and welcome to Leading Edge Medicine with Dr. Jerry Mixon and Dr. Samira Umat. Leading Edge Medicine is sponsored by Longevity Medical Clinics and is devoted to helping you feel and function better tomorrow than you do today by providing the newest and most advanced medical care designed to improve both your body and your brain. Leading Edge Medicine will keep you informed regarding the very latest developments in science and medicine while highlighting some of the Northwest's most prominent physicians, all while helping you separate the science from the silly and the facts from the fiction. This is live call-in radio at its very best, giving you the opportunity to participate in the show. Now, here are your hosts for Leading Edge Medicine, Dr. Jerry Mixon and Dr. Samira Umat, along with their co-host, Lynette Morgan.
And good morning. So glad to be here with you on Leading Edge Medicine. My name is Lynette, here with Dr. Samira Umat and Dr. Christine Brazel. Welcome, ladies. It's lady producer and lady doctors.
Morning,
wow,
yeah.
We could really focus on some girl things today if we needed to.
Yes, we could.
Yes,
we encourage our lady listeners to
call
in with their
in
lady questions.
Questions on longevity, things you're noticing as you're aging, because of course that's what we specialize in. So, Dr. Samira, let's just dive in. Do you have a topic you would like to introduce? And I'll give the phone number, which is 1-800-465-8770. That's 1-800-465-8770. We are live in the studio today. We were off last week. We had a recorded show.
That's right. Actually, yeah. I hope everybody had a great Thanksgiving. This is a time for, reflection. And it's a time to kind of rejuvenate and focus on what is important to you. And us being in longevity medicine, health is always forefront of what we do. Somebody asked me recently, are you guys really busy these days? And I said, in our clinics where we do things on a quarterly basis, we don't really see an end-of-year rush because people are planning for the whole year. They're planning every visit. They're planning how to maintain their health and wellness with the help of the providers. And so I don't see that, met my deductible, need my surgery, got to get everything done that other clinics and other practices see. So it's really a blessing for us, and I count it as a blessing, and I'm very grateful that we don't have that. And it allows us to take care of our patients every day of the year, regardless of whether it's the end of the year or whether it's the beginning of the year. So, we see, in fact, a lot of people come in the beginning as they make their own resolutions and as they want to start the year off right and know what to do this year, knowing that this has happened in their health. So I count it as a great blessing. And with that, we have actually done a huge marketing push on King 5 lately. And so if you guys are listening to King 5, we've been on New Day Northwest on several occasions. And I was there just recently this past week also. And it was a very interesting topic, and it generated a lot of questions even amongst the team over there. And so I was asked to talk a little bit about it today. The topic was mostly about supplements and about how to use supplements and which are good supplements. And a couple of things I want to say is that, supplements don't have FDA regulation like prescription medications do. So when a doctor writes for a prescription medication for you, that medication has been regulated by the federal government, and a lot is known about that. But in terms of supplements, the government allows a discrepancy between what's written on the label and what's actually within the capsule itself. And so you never know what you're getting. So if you're watching social media, and if somebody is telling you that NAD is the best thing since sliced bread, then yes, I've seen it do miracles. But you must know how to use it, when to use it, what amount to use it in, and in what duration. So knowing your numbers and knowing what it does for you is very important. And so with that, I will ask you to ask your longevity doctors to do a review for you and look at the micronutrient analysis. Now, it does cost money. Yes, it's a few $100s, $300 or so. But the test is valuable in giving you objective data to help you guide where you need to go in your supplement needs. And it's very important for nutrients, micronutrients, vitamins, minerals, and it will then help steer you in the right direction. Take strategic things. Don't take everything that is hyped up on social media. That's the message. And the one other thing that they asked me to talk about was the fact that a lot of people are on this protein push, where protein is being touted as helping muscle mass. And yes, it does. The right amount of protein for the right person in the right quantity will help you build muscle mass. And it is very important, but get help from your nutritionist or from your provider to know which one to use, when to use, and also when to take it. There's a contradiction now. The pendulum swings. Every so often you find the pendulum is swinging, and now it's swinging in favor of high protein intakes. And with that comes a knock on the time-restricted eating, because they're asking you to take in protein for breakfast, lunch, and dinner, because otherwise you're never going to get that much amount in your day. But the purpose is muscle, okay? With the GLP drugs becoming more and more popular, we are noticing people losing weight, but people losing muscle. So there's this big push right now for protein to help build muscle, for resistance training, and you'll find a lot of influencers talking about it. But be careful about how much you take and when you take it. So talk to your doctors, get objective measurements. And then the other thing I'll say, which is very important, is that everybody wants convenience today. So powders are becoming very popular, and what people are doing are mixing their powders with fiber. If you're going to make a shake and you're going to put a lot of fiber in it, and you're going to put in your creatine monohydrate, you're going to put it in your protein powder in it, know that with the fiber in it, you're probably not absorbing much of anything. So when you're taking...
Okay.
Yeah, because fiber is not going to allow you to absorb your nutrients. So fiber must be taken separate from when you are eating your supplements and vitamins. And yes, fiber is in food as well. That's a little bit different than when you're actually taking in fiber. So be careful about when you take things, how you mix them, and because you want the best result for yourself. And as always, objective measurements to give you data will guide you in what you need. Yes, you need your medical history. We need to know what is happening in your life. So, Aunt Josie loved this magnesium supplement, and she buys it as a Christmas present for everybody because she wants everybody to benefit from it. Doesn't mean that everybody needs it or that everybody will benefit from it. So you have to think about, what is the magnesium for? Are you wanting to sleep better? Are you constipated? Are your nerves damaged? Do you want it for brain function? And the type of magnesium and the dose of magnesium varies for all of that. So be careful about what you take. Yes, I believe in supplements because traditionally you would want your diet to provide you with all the nutrients that you need. But we recognize that in today's lifestyle, we don't eat a variety of foods to provide us with the nourishment that we need from our foods. Neither does our food have all the nutrients that we need. So given that, I do believe there is a place for nutrients in our lives to help improve basic function. And so it is important, but knowing what to take and when to take is important. Just taking things blindly doesn't matter.
Yeah,
it
or
doesn't
just
help.
because it's on sale at Costco.
No. And, recently, remember, we live in the Pacific Northwest, where by far and away, everybody I check is low in vitamin D. But as I treat my patients, I notice vitamin D levels go high, and it's overcorrected. Remember, it's fat soluble, so it will stay in the body, and it can be toxic to you. So if you're going too high, you do need to stop for a little while to let the levels come down. And it may affect other metabolic pathways, especially if you're on some drugs. Some of the IV medications that are being given for osteoporosis patients interact negatively with too much vitamin D. So you have to be very careful, and you must know how much to take, whether you can take it at all or not, and change the doses periodically so that you don't get side effects from the supplements. So that's what I wanted to start with today, because everybody wants to be healthy.
Yes, absolutely we do. And look at that. We already have a phone call. Should we go right to the calls,
Absolutely.
ladies?
Let's do it. Yes.
Okay. All right. We are going to head to Seattle. We have Lynn on the line to start us off today. Hi, Lynn. Welcome.
Hi.
Hello, Lynn.
Good morning. Hi, doctors. My question is about GI motility. I had a pretty significant case of food poisoning years ago, and I had a partial obstruction from that. And then recently, this year again, I had another. I think it's like a pseudo obstruction in about the same area in the ileum, and as a result, it's like nothing is moving. And the GI doctor I went to basically wanted me to push laxatives, and when they didn't work, he wanted me to keep taking that same amount, and then he'd add other laxatives to take during the day. And I finally said no, because nothing was working. I was feeling horrible. So is there such a thing as a neurogastroenterologist? Would that be the next step?
That's a very good question. I don't know of a neurogastroenterologist, but
There's
did
one
you
in
experience?
Everett and Mason. Yeah.
Oh, okay.
that?
Did you experience nausea and vomiting with your obstruction?
With the first case I did, it was food poisoning, and with this more recent one, it's just not being able to eat, significant bloating, and then every time I had a CAT scan done, and it showed significant, after, it showed the ileum, and then it showed significant colon stool. And so he put me on, gave me Go Lightly, and it took 17 hours for that to work. And that's never, I had a colonoscopy before, and the other prep they gave me it took 2 hours to work, but this one took 17 hours.
Oh, wow.
Yeah, and then I kept calling him because the things that were not working, I said, what am I supposed to do next? And he says, well, go to the ER. And I thought, well, great. But I did go to the ER. They did another CAT scan, saw the same basic thing, and told me to take electrolytes, and, but it's frustrating. It's, I finally just gave up all the laxatives they told me to take and started taking my magnesium citrate powder again, and but I still have problems with the food, not being able to eat very much.
So how often do you have a bowel movement now?
Not like I was, I think in like May and June every day, and now it's like, if I'm lucky, a small amount every other day, but not like I used to.
Okay, so but with a typical obstruction, the symptoms of nausea and vomiting are quite prevalent.
Yeah.
You don't have that though, right?
Yeah. No,
Okay.
and they did a plain film after I went to the ER, and they said that it had resolved. There was no, actual reception there. I just think it's like swelling of loops that happened from previous damage from the first case, because I used to be able to eat anything and everything, and then after that food poisoning, I noticed over a period of time that more and more food intolerances, so...
Yeah. So, a couple of thoughts is, of course, if it is related to gut motility, that's autonomic nervous system, and that can become sluggish with time for some people, especially if there's been a trigger. But if it is related to just the types of food that you're eating, then maybe the gut microbiome is something to pay attention to. So variety of foods in your diet. Do you eat a lot of fiber, a lot of different foods in your diet?
Fiber exacerbates it. In some people,
it does.
Fiber actually helps constipation. With me, it makes it worse, because I have a redundant colon, so I have the extra loops of colon. So when I try to push fiber, I can get more bloating, more constipation. It just, And I used to eat a really good fiber meal every day, broccoli, quinoa, almond butter. I mean, I always had a lot of good nutrition in my diet, so.
What about foods like sauerkraut and kimchi and that help the gut microbiome? Do you...
I think right now my microbiome is so fermented that if I added more fermented food, it would just exacerbate it. I tried those back about 10 years ago, and, I did okay on them, but I think with the situation now, I don't think it would work.
Okay.
So, I mean, I'm going to push along and hope that this, magnesium that I'm taking helps, and maybe the electrolytes, because, for about a year and a half, 2 years, I've been testing every time I have my blood panel done, my sodium is low. So I'm thinking maybe the sodium has something to do with the impact on my intestines. And so.
I mean, I definitely think it's important to keep yourself well hydrated, drink a lot of fluids for sure. And I do like magnesium. It does help a lot of people that are constipated. If it's not other pathology that's causing the constipation, then yes, those simple basic things that you talked about would be things to continue to do.
Yeah. So I thought maybe the next step is to go see the neurogastroenterologist and see what he says.
Did you find one? I actually
there's
don't know.
There's one in at Virginia Mason, but I know it takes 6 months to get in there. When I was in the emergency room, one of the nurses in there said, I tried to get in to see a GI doctor, and it was 6 months. And I said, and he said, they wouldn't even put me on a wait list. And I thought, and you work here.
Wow.
Gosh.
Okay.
Yeah, and they needed a doctor needed hip surgery, but once again, he had to wait too, even though he needed to have the hip surgery. He worked there, but he had to wait.
Yeah.
So I bet, 6 months from now it's going to be here before I blink my eyes. So
Isn't that the truth, though?
yeah.
As I get
Yes.
older, time flies faster.
Yeah. Well, thanks. I think I'll be okay. I had to fire that GI doctor, so I just.
Sure. All right. Well, good luck to you. And
Thank
hope
you.
things go well. Okay.
Bye.
All right.
Bye-bye
Thank you
now.
for calling. All right. Phone lines are open for you to call in. We have Dr. Brazel and Dr. Umat here in the studio to talk about your health concerns as you're aging. 1-800-465-8770. That's 1-800-465-8770. We'll be right back.
Leading Edge Medicine. Leading Edge Medicine. Don't believe the lie that you have to fall apart at the normal rate, and see what your options really are at lmclinic.com. lmclinic.com. Stay tuned for more of the show.
Is chronic pain beginning to make your everyday life a challenge? Then consider the only doctor with over 30 years of experience in pain medicine techniques, including stem cell therapy. That's Dr. Daniel Nelson, MD, with Eastside Pain and Regenerative Medicine. Here's what a satisfied patient had to say.
Yeah, I started about like a year and a half ago. I started having some sharp pain in my left hip. It's getting tough to climb upstairs, tough to play with the kids. Everybody was kind of pointing towards the same thing of, you had to get a hip replacement. And Dr. Nelson's great about saying, hey, there's different types of medicine out there that we can help fix this without surgery. 6 to 8 weeks later, you start to realize like, I can climb a stair. And it was really actually kind of great after that 8-week mark, like, I can start doing things. So definitely see the results pretty quick.
Don't let pain take control of your life. Consider stem cell therapy with Dr. Daniel Nelson, MD. 425-823-4000. That's 425-823-4000. Or you can find Dr. Daniel Nelson online at danielnelsonmd.com.
Oh, it's time to get ready for the holidays and the new year coming up at Bella Medica. We believe that you deserve to look and feel your very best. We're committed to providing you with the safest and most effective treatments available to make you look and feel your very best. Whether you're coming in for a facial, maybe some injectables, or perhaps using some of our laser treatments, Bella Medica has something for everyone. And this month, here are our specials, perfect for the upcoming holidays. Get party ready and schedule your PicoSure or IPL treatment all this month. It's a BOGO. Buy one, get one 50% off. PicoSure or IPL. Make your appointment and get scheduled at Bella Medica. We're located in Kirkland, and you can contact us by calling 844-744-4844 or bellamedica.com.
Have you stopped to think about how you feel today compared to, say, 10 years ago? Are you noticing changes? Less energy, slow recovery, trouble focusing, maybe even weight gain? What if you could turn back the clock and feel stronger, sharper, and more alive? At Longevity Medical Clinic, we help people do exactly that. For over 3 decades, we've been helping thousands of men and women find out what's really going on inside their bodies and take action to feel better and live longer. With advanced diagnostics and personalized hormone and supplement plans, we uncover what's been holding you back and show you how to optimize your health. Our patients often say, now I finally finally understand what's happening and what to do about it. Take the first step today. Call 866-86-YOUNG or visit lmclinic.com to schedule your free consultation. Longevity Medical Clinic. Feel better. Live longer. Let's do it together.
Rocking around the Christmas tree at the Christmas party hop.
Oh, we got some Christmas music going.
Yeah, actually, even the decorations in the office are really nice down here.
I love that.
Yeah.
Now, doctors, did you notice that the Christmas tree down the hall, when you look really
Yes,
close to it,
yes, I did.
it is covered in Relief Factor
Indeed
packets.
it is, yes.
And I didn't. From far away, I thought, oh, how pretty. And then
They
when
are
I
the
got up,
ornaments on the tree.
yes, very clever.
Yes,
far
very
away, it looks
clever.
very, very Christmassy in the little cellophane packages. Just
Yeah,
kinda-
they glitter in light, just
Yes,
like
they do.
any other ornament would
Ah. All right. Dr. Brazel here with us. Dr. Umat, my name is Lynette. Here is the phone number to get through. Phone lines are open, 1-800-465-8770. Dr. Brazel, you said that you had a topic that maybe one of your patients wanted to bring up or talk about.
I did, and it's interesting because our phone caller that we just had, Lynn, had a very similar discussion about what we were going to talk about, and this has to do with the vagus nerve. The vagus nerve is one of the nerves that come from the brain, the cranial nerves, and it controls for the breathing, the heart rate, the blood pressure, and the gastric motility. And so we think about the vagus nerve going out and sending this signal, and it controls things that we don't consciously control most of the time. But on the other side of the vagus nerve is input from the environment, and that is the microbes in your gut, as Dr. Umat was talking about. And when you have infections or you have dysbiosis, which is the wrong proportion of the right bacteria, missing bacteria or bacteria that shouldn't be present, you get mixed signals to the autonomic nervous system, and then maybe you're going to get motility issues, everything coming out too quickly, nothing moving very well. What was interesting about the patient's comment is that it happened after food poisoning, and then she had developed more food sensitivities. And this is a very common side effect of food poisoning, is that the rupture to the membrane of the digestive tract allows food particles to get into the blood, and people get food sensitivities, and they don't go away. But also sometimes the bacteria itself, like E. coli, can give you a toxin called lipopolysaccharide. And there's some other endotoxins that cause ongoing damage to the tissue. Hence, you get the structural problems like a restriction, but also the chemical signaling goes wrong. So for our patients that have these issues, we do the GI effect stool test. It's $499, and it's a very comprehensive test, and I haven't seen a single patient of mine get anything like it from their GI doc when they're going in. So it's going to look at a wide range of bacteria that should be there, that shouldn't be there, the proportions they're in, and the chemical messengers that they're giving out. And so when Dr. Umat was asking about the fiber, too much fiber at any given moment can be an aggravator. And the reason why it aggravates you is you don't have the right bacteria present to handle that fiber. So every fiber type, and everyone says, well, I just take Metamucil, right? Metamucil is a derivative of psyllium, but not everyone can do a lot of psyllium all at once, and then it can aggravate that. So it's not that we don't need fibers, it's the type, it's the duration. And like what the protein diets that people are doing is they're eating too high protein all at once. And a lot of times they're very dehydrated, and then these kind of bullets of protein get stuck because they tend to be constipating, and dairy products also tend to be very constipating, and then they kick up that immune system reaction and the food sensitivity. So it's an ongoing downward spiral, unfortunately, unless you can figure out what your triggers are. And we do food sensitivity testing here for our patients. That's from US Biotech, very comprehensive. It's not allergies, actually, they're sensitivities, and then the GI effect profile. And for our patients with a lot of these issues and the micronutrient panel that was mentioned earlier, we can really get the big picture of why are things not working the way they used to. And if we can figure out correcting the microbiome, it's not just throwing in a probiotic, it's taking the right probiotic. it's not throwing in any fiber, it's throwing in the right fiber. And the timing that she mentioned earlier is really important as well. People sometimes take too much at once or take it at the wrong time of day and get symptoms that could be alleviated with a little more space. And so all of these things, the intermittent fasting she mentioned, there's just different time frames, and people try to cram in 150 grams of protein too much in 2 meals, definitely too much, and then they're going to get a lot of this disruption to their vagus nerve because it's confused with all the signals it's getting. Too much, not enough, wrong timing, and we start building up these bad habits. And our modern lifestyle, of course, is not conducive to eating slowly, chewing your food in quiet with a little bit of hydration. We guzzle these big icy drinks, and these chemical messengers in our beverages are contributing as well. So there's a lot we can unpack at the clinic for our patients if they have questions about this, and a lot of resources to get to the bottom of it that will be outside, of course, the medical system of acute medical emergency, which is where a lot of medical care now is just rotating around acute care. And the long wait is because so many people have these acute problems all the time.
I actually have a question concerning that. Now, what about, I grew up not really drinking with my meal, maybe a glass of water or milk, but I was not refilling that numerous times during my meal. Is it good to drink? I mean, is there a link when you're eating your meal to have something? Well, or can you overdo it?
You can totally overdo it. So when I was in medical school as a naturopath, we had a lot of Chinese medicine training, and it was considered bad for your digestion if you drank cold foods and high volume liquids because it dilutes your stomach acid and it lowers the temperature of your stomach. So the digestive enzymes you make don't work if you're drinking icy drinks. And if you flood it with too much water, you're going to dilute the acid. It's not going to break down the fibers and then the proteins, and then those can be the irritants that are now causing all of these waves of gas and bloating or constipation or diarrhea, depending on which ones. So over dilution of your stomach acids is a problem in the Western world. People drinking guzzler packs of these big.
Can I have a refill of that Coke?
Yeah,
another
it's
one.
It's not a refill; it's a half gallon. You know, they got these mega
by the time
mugs,
you're done.
and it's not good, and it's not a good habit. Now, milk is a liquid, but it's actually a food. So for children drinking milk, it makes sense to get those easily absorbed calories in, but it doesn't make sense for adults to be drinking milk most of the time because it's really a child's beverage, you know, for growth. It's not an adult beverage for growth. There's different things that happen. And the fermented foods Dr. Umat brought up, very different reaction when you have fermented dairy.
Wow.
But you know, dairy does have, as for those people who are not allergic, again, I recognize a lot of people have allergies. And again, you know, let's be clear that some allergies in the acute system are an acute anaphylactic reaction. That's a medical emergency. But what we're talking about here are low sensitivity things. They are irritants, and therefore when they accumulate and they are irritating constantly, they are causing a problem. And so there are, you know, we call them as allergens or things that your body doesn't really like on a regular basis. And some people have definitely lactose intolerance. Some people can eat a little bit of cheese, but they don't tolerate too much. So there are grades of inflammation and inflammatory reactions. So knowing where you fall in that spectrum is very important for your health, but also know that that might change over time. So doing what you need to do at the right time. Right now, the reason I was saying about milk in adults is that I like my latte. And I know it's coffee and milk, but, you know, I grew up drinking coffee and milk. It was a novelty over here, and we call it a special drink. But growing up, we always had coffee mixed in with milk, and that's what we drank. And to me, it's comfort food. And it also gives me a little bit of extra calcium from the milk. It gives me a little bit of protein that I'm looking for. And I'm not allergic, so I actually enjoy my lattes. And they are a source of nourishment for me as well, whereas Dr. Brazel was mentioning rightly, where there is a push for protein, how to take the protein is very important. You cannot add a lot of protein in one meal and call it done. Oh, I did what the doctor told me to do. That's actually going to be harmful for you. So you do have to spread it out. So the question is, how are you going to spread out what your body needs for that time? And if you're doing a lot of resistance training, you will need a little bit more. If you have a more sedentary lifestyle and you're not building muscle right now, you may need less. So that will fluctuate as well. So postmenopausal women definitely need more than they are getting right now, but talk to your doctor for specifics so that they can help guide you. Remember, our goal is to help you build muscle so you can burn fat. In menopause and in postmenopause, there's a redistribution of fat in your body. Whether you like it or not, most people don't. Everybody says, I'm doing the same thing, doc. How come now I have that muffin top that I never used to have? Well, it's not your fault. Your hormonal balance has shifted. With that, your metabolism is changing and your insulin resistance is changing. So you are preferentially going to deposit fat in your abdomen around your abdominal organs. And in an effort to reduce that, you have to target that area and do more resistance training or use those muscles and change your diet so that you can then build more muscle. But remember also in postmenopausal, because of the hormonal changes, your bones are becoming weaker. So you want to do weight-bearing exercises and optimize your vitamin D and calcium so that you can maintain good bone health.
This is such a good discussion. And another question is, with all the GLP-1s out there, you're supposed to have like 100 grams of protein because you're taking that. Well, let's talk about that. And what are some good ways to do that with both of the doctors? Let's find out what are some ways to do that without just getting it all at once.
Let's do it right after the break.
Okay, taking a break. And if you have a question, we would love to talk with you today. This is Leading Edge Medicine, 1-800-465-8770. We'll be right back.
Leading Edge Medicine. Leading Edge Medicine. For the first time in history, you can choose how to age. Call now with your questions at 1-800-465-8770. That's 1-800-465-8770.
Have you been struggling to shed extra pounds? Having a partner on your weight loss journey can make all the difference. That's why at Longevity Medical Clinic, we're excited to launch our weight management program, working hand in hand with you to achieve your weight and health goals. What makes our program different? It's a medical weight management program that uses advanced science to develop your customized prescription, nutrition, and fitness plan. You're under doctor supervision every step of the way. It's our goal to help you look and feel your best now and for years to come. One important thing to know is that our new weight management program will be open to everyone, not just our longevity patients. Call us at 866-869-6864 to schedule your consultation today. That's 866-869-6864.
Are you happy with how you're feeling these days? Are you slowing down physically or mentally? Ever wonder what your life will be like 10 to 15 years from now? Most of us don't really know how we're aging or if we can even do anything about it. But here's the truth. Knowledge is power, and that's exactly where we start at Longevity Medical Clinic. We run advanced diagnostics to find out what's really going on inside your body, and then we create a personalized hormone and health optimization plan designed specifically to help you live better starting now. Our patients are often amazed by what they discover in their blood work, and even more amazed at how quickly they start to feel like themselves again. This isn't guesswork, it's science, it's personal, and it works. Take the first step today. Call 866-86-YOUNG or visit lmclinic.com to schedule your free consultation. Longevity Medical Clinic. Feel better today and every day after that.
The Sugar Plum Fairies.
Yes.
The non-sugar plum fairies. No.
The most fun part of the opera or the ballet.
That's right. I love that one. We all recognize that music. Welcome back. This is Leading Edge Medicine. Dr. Samira Umat here, Dr. Christine Brazel, and my name is Lynette. Here's that number we would love to give to you. We are live in the studio. If you have questions about your health as you're aging, that's what we specialize here at Leading Edge Medicine. Give us a call at 1-800-465-8770. All right. And doctors, we've been talking about protein and eating and gut and GI motility. Another question is, with all the GLP-1s, and is it tirzepatide? Is the other one? Those are slightly different, I guess. You're supposed to have more protein, like 100 grams. They want to make sure, the doctors want to make sure you're doing that. So we don't want to take it too much or too fast. So what's the best way to get that in throughout the day so that we don't jam up our systems?
So as many of our patients know, we do have our weight management program now, and we're offering the semaglutide, and we'll be adding tirzepatide. I think by the end of the year will be part of our prescription package available for people doing that. And semaglutide's everywhere. And is it safe? For many people it is, and it has a lot of benefits for reducing cardiovascular and metabolic disease risk factors, which is the high blood pressure, high cholesterol, high blood sugar, and many of that goes with the overweight and the insulin resistance. So when people take it, the drug helps you slow down your motility, so you definitely don't want to do these drugs if you're chronically constipated or have severe acid reflux, because it can exacerbate the issue. You want to correct that first. Otherwise, you're just playing with a lot of drugs to get the job done. And then, of course, it can take the mind off of the food, and it's the food noise, the food chatter that's always going in the brain that's quieted down and makes you think about it less often, and then you're not always looking for your next snack. So it's easier to stick to a plan. But that's plan with a capital P. And not capital P for protein, but I know what I'm going to eat. I know when I'm going to eat it. I have it ready to eat when I am hungry, and it's ready for me throughout the day. And any successful diet, whether it's GLP-1s or ideal protein or HCG or just regular diet and exercise, must have a plan and not random guessing. I'll eat a little bit of my favorite junk food and lose some weight, because people lose over 20% of muscle mass if they're not planning, hence the call for higher protein. But not everybody needs that 100 grams of protein, but many people do. And that goes to your size, your gender, your size being your height, but also your current weight, your gender, family history. And then, of course, if there's a diagnosis of osteoporosis, you're not going to suddenly get very big and muscular. Adding that extra protein in, you'll probably get a little bit more inflamed, and the kidneys can get inflamed very quickly with too much protein. And I'll tell you what, as Dr. Umat pointed out, if you're not exercising, it doesn't build your muscles for you. What it does is it gets converted to carbohydrate, and if that's not utilized very quickly, it gets stored as fat. So a high protein diet can actually make you gain fat if you're not burning it off or restricting all those liquid calories people like to pour into their drinks or onto their food, which is too much oil, too much whipped cream, or the heavy fat dairy products. It's not all dairy. There's the different components.
Yeah, and even alcohol during the holiday season.
And alcohol, of course, will slow down your capacity to burn fat. It's its own calories, but it also makes fat metabolism really slow. So if it's only protein that you were worried about, it would be easy, but you have to look at the big picture, and that's coming up with a plan. There's a lot of apps now. Noom seems to be very successful for a lot of people. I've also recommended MyFitnessPal. I think there's a tier of good food planning you can get with them that doesn't require a subscription. But frankly, people need to know what they need to eat and how to cook it. And I can't follow you around your kitchen and say, do this, don't do that. I can do that in my office. I can do
want
it in
you
the
to
office.
cook for us.
They do. And I love cooking, but I can't go to everybody's house this Christmas and help them sort it out. So the great thing is AI. I've used this tool with patients where we're like, well, what kind of diet is good for you? And we typed in their calorie goal, and that's determined by me, their doctor. They're kind of low and high. kind of a variation and what type of food should be in there. And you type it into AI, and it can generate a 7-day rotating meal plan. And you say GLP-1s, plant forward, or low fat, and you just put this into your AIs, and it can create your customized recipe plan. You still have to cook it though.
Yeah,
right.
You still have to cook it.
You bring up a very important point, and that is it's become easier than ever before when you don't know what to do. And I have actually put in what vegetables and ingredients I have at home, and I've asked AI to give me a recipe and a meal plan, and it'll do that. And it takes hardly seconds. So it's not that you have to, go out of your way and bring all these things, but you can use up what you have. It'll give you a very nice recipe, and it'll tell you, use these ingredients. This is how you make it, and voila, your food. But you still have to do it.
You still have to do it. And the other thing, and I have found that this can be a limiting factor for some of my patients that have lower mobility, or there are other reasons why cooking during the holidays, for one, might be emotionally difficult, is they do have food delivery services. And I'm not talking about getting, Jimmy John's delivered to your office while you're working through lunch. I'm talking about you can buy meal plans that are really well balanced for protein. They can exclude what you need, and maybe you get lunch and dinner delivered 4 or 5 days a week. And you work on that, and you can fill in your gaps with your breakfast protein. That might be a protein shake or your afternoon snack. But the small little boluses of protein kick up the fire. The giant log of protein just knocks you out. So you want to start early, and the intermittent fasting, of course, you can adjust that. 12 hours is a good minimum for most people. So if you can just do 12 hours every day of no calories, your body, your digestive tract, the vagus nerve, can do its job.
I said that to somebody one day, and she laughed at me, and she goes, "You do realize that's normal, don't you?" I said, "Well, it's not normal for everybody."
Right. Yeah.
Well, but the point that you bring up, very, very good points about meal delivery. What I find with meal delivery services, if you choose wisely, is there's less wastage.
Yeah.
I'm prone to going to the store and thinking that I will be, superwoman, and I'll use this, that, and the other, and pick up tons more than I actually ever end up using. But I find with a meal delivery service, you get the ingredients are counted for you. The portions are sized for you. There's no wastage at all. And in fact, they give you more than what you might need for a meal, so you can make it last a little bit longer. People can share, and they can make enough so that, it's also not cost prohibitive.
Yeah. And the GLP-1s, if you start feeling full, you got to stop. But you can finish that second half of that meal maybe an hour or so later. You don't want to stuff yourself. And time is of the issue, and that goes to, do you have time to chew it? If you're talking to people, you're not digesting your food. If you're in the middle of something else, and that goes back to those mixed signals we're giving the system. We're trying to eat these fast, high-calorie meals, absorb them quickly, also running around and doing exercise. Obviously, exercise is sympathetic, and digestion is parasympathetic. So there's all these conflicts that we're giving ourselves, and we're trying to cram in too much. So if you have to loosen the belt on the time-restricted eating in order to get your small, restricted calorie meals in, it's not 3,000 calorie diets for people on GLP-1s. It's usually, for many people, about 1,500 to 1,800 calories at a max. And so the protein target is proportionately larger, but the actual number of grams per protein stays about fixed. It's the extra fats and carbohydrates that get reduced. So you don't need more protein most of the time unless you're underproteinated. You need less fat. You need less sugar, and focus on getting that little bolus for blood sugar stability, muscle stability, energy production, and hydration between, so your body can digest it. Water helps you digest protein. It helps you digest carbohydrates. It helps you digest fats. And that's drinking water.
Not water that's pop or water that's in
sugar
your latte or what. Okay.
I love my latte.
That's good to
Although
know.
a little bit of coffee or tea is very good for stimulating the digestive juices, and they have their role in motility and energy production, but they can't replace just straight up hydration.
No.
And it's good to start the day with just some plain water to get your whole system kicked into gear. I think it actually turns on your energy production. Your adrenal glands start kicking in just from water.
Well, yeah, and also coffee, actually. It has important polyphenols. But again, if you drink your coffee with your food, you're probably not going to be digesting some of the nutrients from the food.
Yeah.
So apparently the best time, I didn't know this, I just realized this recently, is that the best time to drink your coffee is an hour before you eat.
I had
So
heard
it's
that
like-
too. So it's like, don't get the coffee served in bed. I have friends that do that.
Yeah.
And they have to have the coffee in order to wake up. But they say that drinking a cup of water first
Yes.
and then an
Yes.
hour or so later do the
Yes,
coffee.
yes,
Yeah.
yes.
We're
For-
learning so many
I
things.
know, for hydration, for clearing toxins from the body. First thing in the morning, drink water, and then go to your coffee. Rightly said, Lynette.
There we go.
Yeah.
I do have a shout out for when we come back about cooking and the UMATs. So
I
I'll just
love
wait till we
that.
come
Oh,
back.
Really? Okay.
Yeah.
Ooh. You are listening to Leading Edge Medicine. Thank you so much for tuning in. Our phone lines are wide open, ready for you to give us a call about your health, maybe something that you're struggling with, a recent diagnosis, maybe a loved one. We would love to talk to you. We are in the studio today. Here's that number, 1-800-465-8770. We'll be right back.
Leading Edge Medicine. Leading Edge Medicine. Join in the conversation at 1-800-465-8770 and tell your friends to listen. That's 1-800-465-8770. At Longevity Medical Clinic, we're always looking for ways to better support your health journey. That's why we're excited to share that Longevity Development, our business and marketing arm, has entered a new management relationship with Paramount Pharmacy. We can't tell you where to fill your compounded prescriptions. That's entirely your choice. But for years, we've confidently recommended Paramount Pharmacy because of their excellent quality control, competitive pricing, and outstanding customer service. And now with this closer collaboration, we're working side by side to make your healthcare experience even better. To celebrate, Paramount Pharmacy is offering a 30% discount on your first 90-day supply of compounded medication for all new patients. Interested? Just call Paramount at 425-251-1660. That's 425-251-1660. Paramount Pharmacy and Longevity Medical Clinic, a team approach to better healthcare.
Are you ready to get rid of your reading glasses? Or maybe as you're getting older, and we all are, you just want your vision to be the best it can be. It's time to look into refractive lens exchange at Northwest Vision Institute with Dr. Michael Gilbert. RLE is performed in the same process as cataract surgery. The natural lens is removed and replaced with a high-tech intraocular lens implant. Basically, what that means is your vision will be crystal clear, you'll be able to see far away or up close or both. The difference is incredible. Imagine. No more contact lenses. No more searching for the reading glasses. Most likely, these will be the last lenses you will ever need. RLE is just one of the services offered at Northwest Vision Institute. Come in and see Dr. Michael Gilbert and his team at Northwest Vision Institute. Call 425-450-2020 or online nwvision.com.
It's the most wonderful time of the year.
Make sure I had you.
With
Yes,
the
ma'am.
kids
You got
jingle
me.
belling and
In her
everyone
delightful
telling
Christmas
you be
theme
of good
shirt.
cheer.
Yes.
I understand plaids are in. Plaids
I
and
love
kilts.
plaids.
It's Bear Island plaid is apparently all over the place.
Really?
Okay.
Yeah.
I
So
did
you're
not
absolutely.
even know that.
Did you know you're in fashion today?
There you go. She's always looking so classy.
I set the trends, girl. What can I tell you?
Yeah, that's something we never talked to about with Dr. Mixon is fashion trends. So,
Yeah.
Indeed, we don't.
And you're not going to talk to me about it either. I'm terrible.
and I wore the worst color today. I got on the camera. I thought, oh boy, too washed out. I'll have to remember that. Dress like Dr. Umat, and you will be just fine.
It's
In
my
that beautiful
brown
blue.
skin, I tell you. It's my brown
Yes.
skin.
We are back. This is Leading Edge Medicine. And here's the number to get through. Phone lines are open for you. Plenty of time for your questions with the doctors today. 1-800-465-8770. That's 465-8770 with a 1-800 in front of that. And looks like we're getting a call coming through. But Dr. Brazel, you had like a shout out to the UMAD.
So we were talking about the food and the planning ahead and making meals that you can eat throughout the day. But I just want to give a shout out to the other Dr. Umat for making the best party salad ever, because every time there's a group celebration, his salad makes an appearance, and it's delightful. And it's not something he opened from a bag. It's that Dr. Umat spent the time washing the vegetables, cleaning them up, chopping them, and making a beautiful rainbow-colored display of and there's never any leftovers. So it's always done because it's so delicious. So I just want to say thank you for making the effort, Dr. Sunil. And of course, Dr. Samira for inviting Dr. Sunil to these events.
That was her date this year. Every year.
Thank you for
every day.
Thank you for mentioning that. That's actually very sweet of you. And the thing is, he makes them for you, actually.
He makes them for me.
He does. Because when I asked the team up there, they were like, well, who's going to eat salad? And I was like, okay, fine, we won't. And then one or two people said no. And then somebody said, well, Dr. Brazel will eat salad. So then we said, okay, well, we'll do the salad. And he does most of the grocery shopping too. If he's in a bind, I'll help him. One day, Jerry reminded me his job is more stressful than mine, but nevertheless, he does do it. And he does it out of love.
He probably enjoys it too.
He does.
Stress-free.
Yes, he brings the kale. He massages the kale. He washes it.
And it's so tender, that kale. That's what I'm saying. It's beautifully done.
Yes. And then he'll put all the toppings in, and then he'll make sure we don't put cheese because you are dairy free.
Yeah, I'm allergic to cheese. Back to things that can mess up your digestive tract pretty quickly.
So we'll leave that out separately.
Wow.
And then we mix it up here when it comes here.
Yeah.
So.
But I'll tell you what, I love a good salad, and everybody, you go to these potlucks and people are bringing the worst food or the best food, but maybe not the best balance of food. So every meal should have a vegetable that is not covered with dairy, not just because of allergies, just because it's kind of counterproductive to all of the nutrients that are in there. And so when we're thinking about holiday cooking, people are going all out with all the most heavy items, and it really wrecks your gut. And maybe one day of holiday eating isn't going to ruin you, but people do this for about 6 weeks.
Yeah.
Around Thanksgiving till the beginning of New Year's, and that can throw you off for the whole year, eating just such heavy food. So try to slip in a fresh salad. It sounds counterintuitive for Christmas, but the colors make it nice. And probably everyone could manage to slip in some Brussels sprouts that have been gently roasted. Deep frying things makes them dry, and it makes them inflammatory. So we have been really over roasting a lot of things for deliciousness and not getting in the under roasted vegetables.
With the salads too, you take one or two bites and then you go, oh my gosh, this is so refreshing. It feels like, but I do have a suggestion for people during the holiday time. We eat food wrong. We start with bread and butter and cheese and crackers. Okay, there's nothing wrong with that. Those are my favorites too, and they're my downfall. But if you're really trying to eat healthily and smart, focus on the protein first. So go and add your protein to your plate, eat as much as you want, healthy protein, and then add your vegetables. And after that, you can go look for the mashed potatoes and the bread rolls, and you'll notice that you eat a little bit less of that. So focus on, getting the nutrient-dense food in first, and then try to get in the other foods. And you'll find that you'll do much better in terms of getting the nutrients for your body.
It's an interesting comment because you can look it up online. There's nutrient density in food and calorie density in food, and they're almost inverted. So the highest calorie dense foods have the lowest concentration of nutrients per calorie, and the highest nutrient dense foods have the lowest calories. So lettuces and green vegetables are at the top of nutrient density and the lowest on calorie density. And that goes to our, caveman brain looking for everything it can get a hold of, and we no longer live in those times. And so, but our ancestors, we now know, lived predominantly on plants. They just don't leave anything in the fossil record. So we now can look back and see that our caveman ancestors were actually maybe not eating kale, but they were definitely eating nuts, and they were eating, the berries
seeds.
and the seeds and the tubers. And that was actually a large part of their diet. They just don't leave bones behind. So people assume they didn't eat them, but we now know from microscopic analysis of the teeth that they leave behind, and also, I think, mass spectrometry of the bones, not only what they eat, but where they grew up. They can tell you with the calcium in your bones if it came from northern England or southern England, and if it came from a fish.
True. Yeah. And also, as we've talked about other cultures in the world, people don't waste anything, right?
Yeah.
With the chicken wings, I find sometimes so much meat is left on the wings and the bones. But here there's plentiful, right? So we can afford to do that. But in other cultures where there's scarcity, in other parts of the world, nothing is wasted. I was sharing a room during a course with a lady that came from Mexico, and she told me, she said, we eat every part of the chicken.
Yeah.
We eat the cartilage, we boil the bones, we don't waste anything.
Yeah.
And that's true even in India. I know that where there's scarcity, you don't waste anything. You eat whatever is there.
Yeah. And here, not only are we wasteful, of course, but we're focusing on sometimes the least healthy part of it because of the things that we do to it sometimes is what happens. It's not necessarily, that the chicken is always bad. It's the things we did to the chicken before you cooked it. And I'm not a big fan of the Costco chicken because there's so much things in there that shouldn't be in there, but it's so tasty, but that doesn't make it, even if you peeled all the skin off, it's still embedded with a lot of the salts and gluten, interestingly enough, and flavor additives and things that make you overeat or inflammatory to that gut, and then you wonder why things are off. And back to the previous conversation, a big contribution to the dysbiosis is from some of these bacteria that we're getting from our animals because we raise them differently than we used to. So our ancestors might have been able to handle it, and we aren't able to handle it because it's a different group of bacteria now. Okay. And it's a shame, but this is, of course, the onslaught of digestive stress around the world, and GI problems are skyrocketing everywhere in the world from teenagers and young adults. And now we see the rise of colon cancer in young people is strongly related to this whole dysregulation of the digestive tract and the bacteria and the chemicals.
Okay.
So there is plenty we can do.
Yes.
And Costco has organic, so it's not like it all has to be junk. If you look for it, Costco has a wonderful selection of organic food in the produce section and other places. You just have to push past the shiny boxes of prepared food.
I personally love Costco. Yeah. And my husband thinks that I single-handedly support Costco and keep it alive because my paycheck goes to there.
Yes.
But what I was surprised, I was in Costco late last week, and I was surprised that all of the Christmas stuff is gone. The Christmas trees, the Christmas decorations. Yes.
Already bought?
It's all gone. There's hardly anything left. There's maybe a few bows and ribbons left and a few things left, but
doesn't it go on sale like the day after Halloween?
There's Halloween?
Yeah, that's I think that's when it's out there. I saw it the week of Halloween. I'm like, what are you doing here? But people get it early.
It's in there in July and August.
Oh, wow.
All the Christmas stuff at Costco.
No way.
Oh,
July?
yes. Oh, yes. July and August.
Oh, my gosh.
Because after Christmas, you're going to start seeing the swimsuits and all the summer stuff.
Or the vacation Hawaii suits.
Well, I didn't even take out my Christmas stuff, and I still haven't taken out most of it, but till after Thanksgiving, because you want to enjoy, the Thanksgiving colors, and then Christmas comes out later.
Yes.
I'll be decorating my tree tonight.
Yes,
there you go. They're
to
trying to get us to do it
tree.
earlier and earlier.
Yeah.
Yeah. Wow. Okay. So I just had a quick question for you, Dr. Brazel, about that chicken at Costco. Are we talking?
The rotisserie chicken?
Yes.
I don't know the price, but I think it's unusually low.
Yeah, it's like $4.99 for the rotisserie chicken. And they used to put it in a plastic container with a lid, and now they're putting it in plastic bags.
Correct.
And I had heard that was not good for you.
That is correct.
I can't imagine the part of it that is good for you.
But that's the one you're talking about that has all the extra stuff. And
well, it's just that there's a reason it's so tasty, and the reason it's tasty is not because it's chicken. it's because of the chemicals they put in there. So we talk about all this ultra-processed food, and all that ultra-processed food is adding chemicals that trick our digestive tract or our brain to eat more, even though we should stop eating. So it is absolutely loaded with chemical messengers that tell you to keep going. And that's things like MSG, but there's a lot more than MSG, all those natural flavors that keep you eating even though your stomach says to stop or overrides the signal, and then you keep going. And that's where the GLP-1s are so powerful. They go, no, really stop, and you've already been used to eating 2 or 3 times that amount of food. And so we all have to reset our sensors, but our sensors start on our tongue, and they put a lot of things in there that make your tongue go, I should keep eating, even though the rest of your body is trying to put on the brakes.
Yes.
And so chicken is full of all of those things. But just like the Costco hot dog, I think they kept the price at $1.50.
Yes.
Even though I think
With the pop.
I think the economics says it should cost at least $7, but they keep it $1.50 because they know everyone's going to go buy it. But there's no part of that hot dog that's considered a good choice. So if you say, well, there's protein in it, by the time that protein gets to you, everything else in there is probably doing more harm than the protein itself is helping, which is a bummer. They do carry a lot of processed food that is bad for you, and now we know can be carcinogenic, but they have so many good options for organic food. I just read that they're the largest purveyor of organic produce in the United States.
Okay, so there you go.
They invest in that. And so organics just means you're getting a lot less chemicals, and then you can make some better choices about processing and not processing.
That's good. We're not trying to hate on Costco. We're just talking about some of those convenience foods there that we think are good for us.
Yeah, but they do lure whole families in to get that hot dog.
Oh, yes. Yeah. It's the Costco date.
Yeah.
Hey, we're taking a break right now. We will be back. And we're going to talk about hot flashes because we have a listener that wants to talk about hot flashes and another listener that wants to talk about Subarus.
Uh-oh.
Oh, boy. We're going to talk about that next. Stay right here. This is Leading Edge Medicine. We'll be right back.
Seattle Red on 770 KTTH Seattle, 97.3 KIRO FM, HD3 Tacoma Seattle, 94.5 K233 DT Eastlake, 33 BU Seattle.
The following is a paid program on this station.
Welcome back to this second hour of Leading Edge Medicine. Leading Edge Medicine provides only general medical information. Since everyone's individual situation is unique, you should consult your own physician before taking any action related to your personal health. All content of this program is intended for general informational purposes only. Good morning and welcome to Leading Edge Medicine with Dr. Jerry Mixon and Dr. Samira Umat. Leading Edge Medicine is sponsored by Longevity Medical Clinics and is devoted to helping you feel and function better tomorrow than you do today by providing the newest and most advanced medical care designed to improve both your body and your brain. Leading Edge Medicine will keep you informed regarding the very latest developments in science and medicine while highlighting some of the Northwest's most prominent physicians, all while helping you separate the science from the silly and the facts from the fiction. This is live call-in radio at its very best, giving you the opportunity to participate in the show. Now, here are your hosts for Leading Edge Medicine, Dr. Jerry Mixon and Dr. Samira Umat, along with their co-host, Lynette Morgan.
And Dr. Mixon is gone this week. We have Dr. Samira Umat in the studio and Dr. Christine Brazel here with us for hour number 2 of Leading Edge Medicine, which of course is brought to you by Longevity Medical Clinics. And we have 3, one in Kirkland, Tacoma, and in Linwood. And Dr. Umat, maybe you could explain what that health analysis does, why it's so important to find out, even if you think like, hey, I'm 50, I'm 60, I'm 70, I'm feeling great, I don't have any problems. Why it's important to find out what really is going on in your body, and let's just make you feel better, right?
Yeah, no, absolutely. You know, if you are at all following what's happening in aging medicine, then the message here is that normal aging is a disease process. And if we view it as such, and we try to tackle those aging processes, then we can help you live longer. And there is a lot of influential people, wealthy people, that are talking about what they are doing to themselves. And if you're looking, then you'll find that there's a lot of confusion about what is right. Is it really good for me? Is it expensive? Can I even afford it? And so what we've done here at Longevity is that 30 years ago, Dr. Mixon started these clinics, and he has been building up on what is the latest in science in all of these forums. And it's just that now more and more awareness is out there. So the big thing that everybody's saying to you that you should all know is just don't die. Don't die, because there are things that are being worked out that will change the trajectory of your future. And we started off talking a little bit about AI, and AI is going to be at the helm of this, because without AI, we don't even know the things that we have tried that might be useful. So things like rapamycin, metformin, sirtuins, mitochondrial dysfunction, inflammation, all of these issues, senescent cell damage, replacing senescent cells, these are all buzzwords. And there are new tools that we are going to be able to explore more. Some are already being explored, and some are in the horizon that will change how we age. Plasma exchange is a big one that a lot of wealthy people are doing these days, and I'm asked about it all the time. But these are things that you can do if you have the money. But for those of us that want the best, but don't always have millions of dollars to spend on ourselves, you can do a few basic things. And I think the first step to doing that is coming to Longevity to do your health analysis. So forget the complimentary health analysis visit. I think if you're coming in, you should be planning on doing the 595 blood draw, because that 595 draw panel shows you so much more than your doctor will ever do. I was meeting a friend of mine recently. She said, this is a true story. I'm not making this up. She's 72 years old. And she said she goes for her well visits to her primary care doctor annually. Her doctor asks her to come. She goes in, and nothing is done for her. She had a blood draw in 2019. And in 2022, when she asked for it, they didn't do another blood draw. In 2023, somebody suggested to her that she should have a basic CBC. Do you know how much a CBC costs? $10. She had a basic CBC that showed she was now anemic. So now they are looking for colon cancer for her. It didn't need to be that way. A $10 test could have been used to diagnose issues for her earlier in life. So for $595, you can do a huge panel. Some things that your doctor may be able to do, some that they don't even know what to do with if they do, like DHE and pregnenolone levels. But once you know that, you then have an understanding of where you stand with your health. So I'm tired of hearing people tell me that their doctor didn't do this, that, or the other. You know, they're constrained by insurance. They're constrained by time. They're constrained by people tying their hands behind their back. Fine, I give them a pass on it. But it is our responsibility. And if it costs $20,000, I'd say, oh my God, I can't afford that. That's ridiculous. But if it's $595, I think we spend that kind of money on ourselves all the time for so many different things. This is a treat for you to know what is going on inside of you. And that is our health analysis visit. That gives you 1.5 times of physician time, which is a lot in this day and age.
Oh, yes.
Where do you get to talk to a doctor for that long? And after that, you get to decide whether you want to stay on with our clinic and avail of all the other things that we offer for you. I can keep counting, keep going. But that is the time that you decide, okay, do I want these people to continue to take care of me? Do I want to know what's happening in my gut? What is happening with my GI issues? What are the nutrients that I need to buy? Why am I spending all this money on supplements? Do I need IV therapy? Do I need senescent cell therapies? What is rapamycin? Is it good for me? All of those questions that you have wanting to know more about, because it's what everybody's talking about, we will answer them for you. We will separate out what is true and what is fiction. And that is the advantage of coming to our clinic.
Absolutely.
And $595.
There you
That's
go.
it.
Thank you, Dr. Umat. That's what it's all about. And here is that number to call to make your appointment. It's 866-86-YOUNG. That number to get through is 866-86-YOUNG, or you can go to our website, which is lmclinic.com. That's lmclinic.com. All right. We have a caller that would love to talk to you. Let's go to Carol in Bothell. Welcome, Carol. This is Leading Edge Medicine.
Hello, Carol.
Hello. My husband and I have been longevity medical clinic members in Kirkland for 2 years now, and we're extremely pleased. We're both senior citizens, and his doctor is Dr. Pentland, and mine is Dr. Brazel, and we're very happy with both doctors. Since being on a longevity, I mean, I was on your weight loss program, and I lost 25 pounds. I have a lot more energy and so forth, and I'm back to my high school weight and measurements, which is just wonderful, even though friends of ours says, oh, that's impossible, but I'm down to it. But I'm calling about hot flashes, and I've talked with Dr. Brazel about this before. What happened, I was doing very well until one day, Costco, we love shopping at Costco. I got a big bag of bins, organic rice crackers, and I didn't realize how much added sugar there was in it. And I ate like about, 3 or 4 packets of it, and each packet has about 3 grams of added sugar. And I just came down with hot flashes. I had no idea that would cause my hot flash in the wee hours of the morning. Before I was menopausal, I would have hot flashes during the day, but I don't have hot flashes. I didn't have hot flashes during the day after eating my bins. I had it in the wee hours of the morning between 1 and 4 o'clock in the morning. And so after Dr. Brazel told me to stop eating that, the hot flashes went away. But I'm also on my compound progesterone, testosterone, and estradiol, and I was out of my progesterone for about a week or so, and then eventually out of my estradiol, and so I got all of that about 2 days ago, so I'm back on that. But before I got back on that, I started getting hot flashes again, and I'm back on my hot flashes, even though I'm back to my full schedule of my compounded hormones. And then I realized that I had been eating chickpeas from Costco, organic chickpeas, and my husband happened to look in the on the package, and it says it has a gram of sugar, added sugar, for 20 pieces, and I must have eaten a bowl of that. And so I'm wondering, is there a connection now with that, or do you suppose my not having had my compounded hormones that could have contributed to my hot flashes?
Sure. So first of all, I want to say thank you for calling in. I so appreciate your calling in and giving a shout out to both Dr. Pentland and Dr. Brazel. We do appreciate those calls. You know, it means a lot to us because we really work hard. Our doctors work hard. They train hard. And it's very nice when people appreciate the work that we put in. So, and thank you, Dr. Brazel, you're here today. It's really nice to get that feedback. Secondly, to answer your question, I do think there is a correlation, but Dr. Brazel's here looking at me, so I'll let her, since you're her patient, I'll let her take over and respond to your question, okay?
Well, there's a few things there, and that's for everybody listening, of course, is the hormones do help a lot of the symptoms of the vasomotor symptoms, which are hot flashes and night sweats. And it can be too much estrogen compared to your progesterone, too much progesterone compared to your estrogen. And so there's not just hormones altogether, but the hormone balance between the two.
Right.
And everyone tolerates it a little differently.
And also, you know, your testosterone plays a role in here too, because some women will benefit from just testosterone as well. So any hormonal imbalance, especially when you are out of your estrogen for a while and then out of your progesterone, now going back on them may alleviate the symptoms, but then a trigger may impact what happens and your symptoms may come back. So you may need a readjustment of your dose, okay?
And that's something that we can talk about personally. Of course, you can get on the calendar with me next week or the week after if you have some questions. But the other thing that was important about the sugar, I don't think 1 gram of sugar is really going to be the problem. It probably for you, it was getting off of the hormones and letting your body get re-regulated. But it does have to do with what your body does. So earlier in the program, we were talking about the autonomic nervous system and digestion and disruption. And then, of course, there's the parasympathetic nervous system is when your body does something called rest and digest. So a lot of women will wake up between about 1 and 3 or 1 and 4 in the morning with all of these sweaty, they're drenched, they're hot. And you have to look at what you were eating a few hours before, because that's when a lot of the metabolites from digesting your dinner will have gone through your bloodstream once or twice and are hitting your liver. And then the liver goes, oh, what's this giant bag of sugar that I have to now deal with? And it sets up a little hot flash. Or alcohol and does cause this as well. And there's alcohol itself, but also most alcohol is consumed with a fair amount of fat or sugar, either, drinking wine and eating crackers, but also the sugar in the wine itself. So we have to think about the totality of our food. And it's a lot. The body has to manage all these things while you're sleeping. And so that's that disruption is there's probably a giant bolus of too much of something all at once. And that's the snacking thing.
Sure. And that is also a very important point. But the other point that's important related to this is the timing of eating. Mm-hmm. So the general consensus to date has been you should not eat anything 2 hours before going to bed. And that way your sleep cycle is better regulated and the food is not going to affect your sleep rhythm. But recently, I actually heard one influencer talk about that being extended to 4 hours. So the message here is that the longer you eat, the longer time elapses between your eating your last meal and then going to bed, the better off you'll be. So if you eat by 7 and then go to bed by 10 is probably better than eating at 9:30 and going to bed at 10, or staying up till 11 but feeling hungry and then eating your ice cream bowl right at 10 to 11 because now I'm hungry before going to bed. And if I eat and have food in my stomach, I'll feel satiated and I'll sleep better. That's such a fallacy, because food in the stomach actually disrupts your sleep. And similarly, alcohol does too.
And back to the ice cream, of course, at any time of day it can be rough. But if you really absolutely need to have that ice cream, have it at lunch. And give your body a chance to metabolize it and burn it off long before you get to sleep. But smaller amounts if you're trying to keep your weight down, or made from non-dairy products if you're having the issues with lactose intolerance and dairy allergy. But it's still full of sugar and fat unless you're making it from bananas, which most people aren't, but then it's not really ice cream. So I understand that people want their treats and timing is important.
Ice cream?
Yeah, but I'm allergic to bananas, so I guess.
Not for you, right? And
yeah,
then also,
not for me.
Yeah, with intermittent fasting, it's really important. It's about earlier eating, not skipping breakfast.
Okay. Hey, we're going to continue on this. Carol, stay with us. And Terry, we're going to get to your call too. You're listening to Leading Edge Medicine. Here's that number to get through with your question, 1-800-465-8770. We'll be right back.
Aging gracefully is a terrible option. Learn to live to your fullest potential. It's a lot more fun. Call now with your questions at 1-800-465-8770. That's 1-800-465-8770. And stay tuned for more of the show.
If you have chronic pain and are considering stem cell therapy, consider the only doctor with over 30 years of experience with pain medicine techniques, including stem cell therapy. And that's Dr. Daniel Nelson, MD, with Eastside Pain and Regenerative Medicine. Here's what a satisfied patient had to say.
I would say Dr. Nelson is a great guy. He's very personable, makes you feel very comfortable, as does the staff. Everything went well. I had the stem cell injections, and within a month, I really had a change in my knee. It was unbelievable to me, honestly. I thought there'd be more pain involved with the procedure, and there was hardly any. It was amazing, and I've told a lot of people about it. After having it for 2 years now, it worked tremendously. Glad I did it.
You should consider stem cell therapy, but call a medical doctor with experience. Dr. Daniel Nelson, MD, 425-823-5800. 4000. That's 425-823-4000 or DanielNelsonMD.com.
What if weight loss didn't feel like a lonely battle? What if you had a proven tool and a trusted guide by your side? At Longevity Medical Clinics, our medically supervised GLP-1 weight loss program helps you shed pounds, boost your metabolism, and feel more like yourself again. But unlike online programs that drop medication at your doorstep and disappear, we take the time to understand your body. We track your lab work, monitor your safety, and adjust your plan so that your results are healthy and lasting. Because weight loss isn't one size fits all, and you deserve a program designed for your unique biology. If you're serious about losing weight and you want to do it the right way, Longevity Medical Clinic is here to help. Call Longevity Medical Clinics today at 866-86-YOUNG or visit lmclinic.com for your free health analysis. Longevity Medical Clinics, real medicine, real monitoring, real results. Call 866-86-YOUNG or visit lmclinic.com.
She has to finish something, but I know who she is. She's lovely.
Oh, I always think of Charlie Brown Christmas when I hear this. And they're ice skating, and the snow is falling, and such
and
a beautiful
Bellevue
picture.
Ice Rink is open, I heard. I haven't been. Yeah.
Okay, and they have one at the Tulalip Casino.
Oh, they do?
Oh, and yes, it was really small last year. They've expanded it this year, and they have the most beautiful light displays.
Oh, wow.
And I actually drove past as I was coming in today, and I saw all the lighted trees, just gorgeous.
You know, Lynette, when I was a kid, I grew up in New York, right outside New York City, which a lot of people may or may not realize. And we had a pond around the corner from our house, and I learned to ice skate from when I was about 2. And every winter, I'd be out there all night, all weekend, ice skating, because I was going to be the next Dorothy Hamill.
Of course, yes, you were.
And if you remember that age, Dorothy Hamill had the ice capades. I saw her in the city, and she was just a dream and so inspiring.
And the
I was
haircut.
I was going to be the next Dorothy Hamill. It didn't work out. After all,
you're saving lives instead.
I am or saving myself from falling on the ice there. But that was in the old days when you could have a frozen pond all winter.
That's right, you could.
The boys would be on
lived
one
in
side.
Rochester, New York.
The dads and the boys would be on one side doing the ice hockey and clearing off the snow, and the ladies would be on the other side learning to skate backwards and do our little twirls.
And twirls.
And I was a committed ice skater. And so I miss those days fondly, but I don't think my hips would appreciate it now.
No, but those are common themes up on the northeast, especially around Canada.
Yes.
Sunil grew up doing the same thing in on the east coast of Canada where he grew up. So it's really fun. Yeah. But then you learn a lot of winter sports, and you learn to enjoy winter because you have to, because it's such a long part of the year.
My sister still lives in Vermont, and I will not visit her in the wintertime.
Only in the summer.
After living in Arizona so long, I just can't do it. But I even got to skate at Rockefeller Center. I was a kid.
So I was going to say, I saw the lighting of the tree the other night on TV, and it's, I think, one of my favorite things to watch when the Christmas tree in New York is lit at the Rockefeller Center, and listen to the music. I think it brings the onset of Christmas for me.
The nostalgia is so associated.
And it's just a wonderful time of the year. And I know it's not for a lot of people. And so holidays can be tough for people. And so I want to acknowledge that. But I realized a few years ago that some of it is also what we make of it ourselves.
Yes.
It's not always about entertaining or being entertained. I find that the shopping thing is very stressful, actually. I don't like going to shopping malls. I don't shop online. I find all of that very stressful. But I think we can all kind of find a little bit of joy in what gives us joy. And it doesn't have to be associated with parties and foods. It can just be, part of being a group, part of giving back to somebody else. I have now reached a stage where I find more joy in watching other people happy about what I've given them.
Yes.
So it's interesting that I've seen that thing, I don't have a list of what I want, but I do want to see other people.
Well, the giving is the receiving.
Yeah.
Yes.
Yeah.
Yes.
It's definitely a time shift as we get older.
It sure does. Carol, are you still with us? Did we get
Yes, I
everything
am.
for you? Thank you for reminiscing with us.
My husband and I are getting our blood draws the middle of this month, and I'll be seeing Dr. Brazel, and my husband will be seeing Dr. Pentland in the middle of next month. And we appreciate everything they've done for us, and we think that the best investments we've done is with Longevity Medical Clinic, and we really appreciate the care that we're getting.
Thank you so much.
Thank you so much for saying that. I wish you continued health and goodwill. But also, if you needed to speak to Dr. Brazel prior to your blood draw because of the ongoing hot flashes, please call the office Monday and schedule an appointment for a quick consult. She might have some tricks up her sleeve that might help, resolve some of the issues you're having before the blood draw. Okay?
Thank you very much, and bless all of
Very
you.
welcome. Thank you.
Thank you
Although
so
my
much,
schedule
Carol.
of late has been so full, so I apologize if you have to wait. We have had so many new patients.
Wow. That's
awesome,
so,
isn't it?
That's
Dr.
good.
Pentland and I were talking about it. Normally, this time of year, people start getting busier with other things, and we have been. I've had my calendar, I think, almost completely booked since mid-October.
Yeah.
And it looks like that the next week or two, we still have quite a full schedule. And there's the message about longevity that's getting to the world, not just our clinic, but as Dr. Umat was talking about with the Brian Johnsons and other people of the world, saying there's plenty you can do. And of course, a few weeks ago, the Peter Attia special on 60 Minutes. And he has his own opinions, and he does a lot to promote the longevity message through healthy exercise. But we've absolutely seen a huge increase seasonally because people really don't want to go into next year feeling crummy.
Yes, that's true.
And they're coming in for that health analysis, and they're becoming patients because the cost of our program is nothing compared to the disability later that they're seeing their parents developing because they didn't invest early. They didn't know what to do. They expected medical care to take care of it,
No.
and it can't do
Sure,
all that you need.
Not only that, it's the other longevity clinics are charging so much more than we are. And as
Yes.
we heard that from Atia's presentation on 60 Minutes, if you haven't heard that, you really should listen to that.
If you're not a
I think,
multimillionaire,
yeah.
you can still come to us.
Absolutely.
Yeah.
But on the other hand, we actually want our doctors to get busier. We have more doctors. We have more room to see you.
Yeah.
So if you are just sitting on the fringes, just thinking about it, it's really that time for that investment.
Dive in.
You.
Yeah, we're really glad for our 2 new doctors that have joined the team because our schedules are filling out. And then, of course, we have to take the phone calls from our patients in between those blood draws to
Indeed.
answer those questions about night sweats and hot flashes that aren't part of the routine visit.
Yes, very good.
And we
Thank
do
you,
take
doctors.
the time, yeah.
All right. Well, we've got more phone calls. We've got several here waiting. Let's talk to Terry in Whidbey Island. Terry.
Hello, Terry.
Welcome.
Hi. I'm Terry. I've been with the longevity people for 26 years, and this is the South Whidbey Island is the home of Nathaniel Armstrong, your naturopathic doctor.
Yeah.
And,
Yes.
I'm a member
Welcome back,
of the
Nathaniel.
And I've been at the Linwood Clinic, and I'm 5 months older than Dr. Mixon, and we're both Vietnam combat veterans of the United States Army, and with a heavy emphasis on combat.
Yeah, well, thank you for your
previously I
service,
heard-
sir.
Oh, thank you so much. And like I said, I've been with you guys for 26 years continuously. Dr. Brezwell, you talked about how the Subaru saved your life.
Yes. That was quite a
And
while
that
ago,
you
but
would
thanks
never
for
have another-
remembering.
and that you'd never have another car but a Subaru. Is that true?
My
Anyway,
Crosstrek just crossed 60,000 miles, and it's in mint condition, and it will remain that way because it's worth taking care of it.
Do you have a similar story?
Yes, I sure do. My 1990 Subaru Legacy will be 36 years old tomorrow. And I just bought a 2025 Subaru Legacy Touristy XT, the top of the line. And you close the door on my 1990 and you close the door on this 2025. It's like a tank. I mean, it's so well constructed and the frame is so strong that it's just miraculous what they've done now with these beautiful new cars. And Of course, my car can drive itself. But my cruise.
That's true.
Oh. All I need is two lines, a center line and a side line.
And it will do it. Yes, they do drive themselves.
The new bells and whistles on them now are pretty amazing.
They are. It takes a little getting used to. I'll tell you, I was traveling to the Tacoma Clinic with Dr. Mixon, and his car drove us there. And Bob and I were both in the car, and we're like, "You're not scared to let it do its thing?" He goes, "Well, you get used to it. And the more you let it do it, the more you realize it's doing a good thing. And so it'll figure it out." And there were a couple of times, when it was overtaking and he was saying, "Are you sure you want to do this?" But he'd let it do it.
Yes.
And it did. And it got us there on schedule and on time. And
my new Honda does the same thing. And it took me a long time to get used to that. And it lets me know when I can, the blind spots.
I don't have a car that'll drive me. I wish I did. I have to drive myself. But thank you for sharing your story, sir. That is nice. That is great.
Yeah, thank you so much. I listen to you guys all the time. And tell Lynette I was born in Kansas. That's pretty close to the Show Me State.
Oh, yes, Missouri for me. So, born in Seattle, but raised in Missouri. So, in the Ozarks. But I don't sound like that no more. I don't have any accents left.
Only when she wants it.
They're in a shoebox in the closet. Just
there you go.
For special occasions.
Thank you for that, Terry.
Thank you for your call, and thank you for being a patient for so long. Yeah, we were actually very happy Dr. Armstrong came back from Texas. He didn't like it there after all.
There we go. And he did not bring an accent.
No, he did not.
Thank you so much, Terry. All right, we're taking a quick break here. We will be back with Rick and Gabriel with some tough topics here in just a moment, and a yummy topic, too. We'll be back with more Leading Edge Medicine. Stay right there.
Leading Edge Medicine. Leading Edge Medicine. Listen to past programs by going to lmclinic.com. Call in now at 1-800-465-8770. That's 1-800-465-8770.
Meet Sarah. She tried one of those online weight loss programs. Filled out a form, got a prescription, and a few weeks later, she felt dizzy, weak, and frustrated. No one was checking in. No one was making sure the plan was safe for her body. That's when she turned to Longevity Medical Clinics. Our medically supervised GLP-1 program helped Sarah lose weight safely, while we monitored her progress every step of the way. Today, she feels healthier, stronger, and more confident than ever. At Longevity Medical Clinics, we believe weight loss isn't just about dropping pounds. It's about restoring your health, with real doctors, real monitoring, and a plan that works for your body. If you're serious about losing weight and you want to do it the right way, Longevity Medical Clinic is here to help. Call Longevity Medical Clinics today at 866-86-YOUNG or visit lmclinic.com for your free health analysis. Longevity Medical Clinics. Safe, supported, life-changing. lmclinic.com.
Oh, it's time to get ready for the holidays and the new year coming up at Bella Medica. We believe that you deserve to look and feel your very best. We're committed to providing you with the safest and most effective treatments available to make you look and feel your very best. Whether you're coming in for a facial, maybe some injectables, or perhaps using some of our laser treatments, Bella Medica has something for everyone. And this month, here are our specials, perfect for the upcoming holidays. Get party ready and schedule your PicoSure or IPL treatment all this month. It's a BOGO. Buy one, get one, 50% off. PicoSure or IPL. Make your appointment and get scheduled at Bella Medica. We're located in Kirkland, and you can contact us by calling 844-744-4844 or bellamedica.com.
At Longevity Medical Clinic, we're always looking for ways to better support your health journey. That's why we're excited to share that Longevity Development, our business and marketing arm, has entered a new management relationship with Paramount Pharmacy. We can't tell you where to fill your compounded prescriptions. That's entirely your choice. But for years, years, we've confidently recommended Paramount Pharmacy because of their excellent quality control, competitive pricing, and outstanding customer service. And now with this closer collaboration, we're working side by side to make your healthcare experience even better. To celebrate, Paramount Pharmacy is offering a 30% discount on your first 90-day supply of compounded medication for all new patients. Interested? Just call Paramount at 425-251-1660. That's 425-251-1660. Paramount Pharmacy and Longevity Medical Clinic, a team approach to better health care.
Oh, I think that's Kenny G, our very own from Seattle. Kenny Gerlach. Yeah. Look at that. Okay, so we are back. It's Leading Edge Medicine with a little Christmassy music in there. My name is Lynette, along with Dr. Samira Umat and Dr. Christine Brazel in the studio, and we're taking your phone calls. We are headed to, not too far away, Kirkland. We have Rick on the line. Hi, Rick.
Hello, Rick.
Hi, Rick.
Hey, good morning. So my wife found something on the internet that said that you shouldn't put a banana in a smoothie because it impairs the absorption of the other nutrients from the other ingredients.
Yes.
Is that something you guys are aware of?
Yeah. I've seen a little bit on this, and of course, when we were talking earlier about calorie density versus nutrient density, a lot of the nutrients we're getting from our fresh fruits and vegetables are polyphenols, as well as bioflavonoids, and that's where the good action comes for the immune system function, the anti-aging, your curcumin and your resveratrol, and all of these things we give you in concentrated doses come from fruits and vegetables, and they're in those categories. And we have found, or not we here at Longevity, but we, giant scientific community, that bananas tend to be very low nutrients. People tout the potassium, but of course you can get potassium in larger quantities from almost every other fruit and vegetable, like oranges and green vegetables. But bananas are very high calorie, low fiber, and with low fiber is low polyphenol account. And there's something about bananas that prevent the absorption of the polyphenols from the berries and the apples that you might be putting in that smoothie.
All those expensive berry bowls that people pay for with bananas and berries and yogurt and granola in them.
Yeah, so we'd like to put in the banana because they're cheap, they're satisfying and creamy. As I mentioned
Most
earlier,
people like them.
You can freeze them and make them into sort of an ice cream or yogurt-like consistency. Unfortunately, there does seem to be reduced absorption of those polyphenols when you put them together. So I think you could eat them in the same day, but maybe not in the same smoothie. But depending on my patient, if my patients are trying to gain weight, I say throw a banana in your day. And if my patients are trying to lose weight, I say leave it out. And of course, observing whether or not you have food sensitivities. We were talking about that. I don't do very well with bananas anyway, so they're easy for me to avoid.
And I'm allergic, so it's like, nope.
So no matter where you're getting them, they're going to disrupt your microbiome and make impaired absorption of nutrients if you have a chronic sensitivity or response. But it turns out that they block I think very specifically it was the polyphenols from berries that were not absorbed, like those wild blueberries that you just spent $20 for a bag of frozen berries from Costco that are wild. You want every one of those to count.
To be absorbed and to do what it's supposed to do for you.
But I have heard about that a little bit. I didn't do a deep dive in the research, though. I did a peripheral dive there.
Okay. And then, Rick, you had another question, too.
I do. Yeah. And it comes from Peter Attia's book, Outlive, which is outstanding. If anybody's interested in longevity, they should read the book. In his book, there's a reference to Alzheimer's using intranasal insulin treatment to improve cognitive performance and also maybe even preserve brain volume. Is that something that you guys can comment on?
Yeah, I'd be happy to comment on that. You know, that's an interesting phenomenon. So the thought was that with the intranasal spray, what you're trying to achieve is getting it past the blood-brain barrier and directly into the brain. And so if the thought is that too much sugar is in the brain and that is a pro-inflammatory agent, then getting the insulin directly through the intranasal spray into the brain will lower that sugar level, and therefore it might help decreasing inflammation and might help with Alzheimer's dementia. So the original studies were actually very promising, but unfortunately the long-term study, the SPIF study, didn't show this to pan out for most people. And they're not quite sure why it didn't. So there's two schools of thought on that. One was that the patients that have the APOE4 genome may react a little bit differently than those that do not. So if you have the genome, maybe you're not going to respond to this insulin reduction in the brain. But if you don't have that, and maybe if insulin resistance is the cause of the memory issue, then you might respond a little bit better. So the studies are not quite conclusive on that, but some people are using it. I'll tell you, I've been interested in this because also of the GLPs. Remember how when the GLP drugs were being used, a lot of people were wondering if that'll also actually reduce inflammation in the brain, because it seems to be doing peripheral reduction of insulin and therefore improving in the inflammation marker, especially high sensitivity CRP. And so the GLPs were also studied for this very reason in early dementia and Alzheimer's dementia. And the EVOKE trial and the EVOKE 3 trial also showed that it didn't pan out. Sadly, they showed an improvement in the markers for the patient in the blood panel, so high sensitivity CRP improved, but functionally there was no improvement in their dementia. And this was in 4,000 people over 2 years that they looked at it. So it was very interesting, a little disappointing, and they actually used the oral Ozempic for this. And so they showed a little bit of weight loss, and they showed that there was an improvement in inflammation and many of the other parameters that we talk about with health, but not so much in memory. So two things that have been looked at recently. I'm still hoping, though, there's more stuff around the horizon, because they are really looking at this very closely. As you know, memory loss is such a big loss and such a big part of aging and age-related diseases. Like we've said many times on this show, if you lose your memory, you really are one of those unfortunate people that die twice. Once when you lose your memory, and then the second time when you actually physically pass away. So very tragic course of a disease, and I would love to see. And you're right, Atia talks about the neurodegenerative conditions as one of the horsemen and one of the 4 pillars that we really do need to tackle in modern medicine, what he calls 3.0, medicine 3.0.
You know, Dr. Umat mentioned the APOE4 gene, and of course, people carry this. You don't know you have it unless you get tested, and it's something that we offer at our clinic. For our long-term patients that don't know if they have it, we can do this as a standalone test, and for people who have been joining our program recently, it's part of their sign-up package to get this testing done. And how I use that information clinically is if you carry that APOE4, I know you're at higher risk for heart disease, for stroke, for dementia. I know that you're at higher risk for insulin resistance, but it's not only sugar consumption. And when we're talking about sugar, of course, we're talking about cane sugar, which is sucrose, which is an added ingredient as opposed to natural complex carbohydrates, which behave very differently, and they're attached to those polyphenols and those fibers. But a lot of the APOE4 damage is not specific to sugar intake. It has a strong impact, but also intake of saturated fats. And for many people with that gene, they don't metabolize them the same way. Now, naturally in the world, people carry this gene and they don't develop Alzheimer's because they don't have a lot of saturated fat in their diet. So being able to conserve it makes sense. But in our modern world, we have so many exposures to it that the body can't get rid of it, and it's part of the pathway. So insulin resistance actually can be a product of overconsumption of saturated fats as well as overconsumption of added sugars. But complex carbohydrates do not drive this problem. The omega-6 and omega-3 from the vegetables like the olives and sunflower seeds do not drive this problem. And APOE4 is very specific to that pathway. So keeping cholesterol down is actually critical for managing insulin resistance. And for some people, it's going to take drugs to get that number to the preventative stage, or at least prevent progression of the arterial damage that does happen in the brain. We just don't always get those images.
And Atia is very clear on that, that for us to say an LDL of 100 is okay is not all right, because it is a progressive disease and it is going to continue to cause damage. So for all of my patients that are opposed to statins, there are newer drugs that will help you lower your LDL cholesterol and total cholesterol levels. So if you're not aware of them, please do ask your providers about it, because it is important to reduce the risk for heart disease. Again, this is all about very subtle things. It's all about improving health span in lifespan. You want to live so that you can enjoy the things that are important to you, and especially that last decade of your life where we compromise a lot on our health. We live, but we don't really live. We're alive, but we're not living. And that's what you want to change. You want to be alive and living till the very last day. So those are important points. And intranasal insulin, again, not mainstream yet, still in phases, but has shown promise in some of the studies, maybe not all. Now, you also need both the APOE genes, right? Not just one. So if you have one APOE4, then the risk of your expressing dementia is less than if you carry both. But also remember, people that have both can also avoid having memory loss. So that is an important thing to know. It increases your risk, but there are things that you can do that you can avoid going down that road. And Dale Bredesen wrote his very good book. He's a neurologist from Cleveland Clinic. His first book was called The End of Alzheimer's, and then he wrote about the patients that were treated for all the other things. It's like a tin roof with holes in it, and you got to keep plugging all the holes that appear. It's not just one thing.
And they're very clear about removing sugar from the diet as a critical factor.
Well,
the
it is
added
one
sugars.
of the things, right? So it's one of the things, and everybody's ability to avoid it is different, but paying attention to it is important.
Yeah.
Okay. Did that help you?
Great answer. Oh, fantastic. Thank you guys so much.
Thanks for calling.
Thank you, Rick.
Yes, thank you for the call, Rick. All right, we will take a break. Then we are talking with Gabriel. In just a moment, you are listening to Leading Edge Medicine. And if you'd like to be a part of the show, we might be able to squish you in. 1-800-465-8770. We'll be right back.
Leading Edge Medicine. Leading Edge Medicine. Don't believe the lie that you have to fall apart at the normal rate, and see what your options really are at lmclinic.com. lmclinic.com. Stay tuned for more of the show.
GLP-1 weight loss medications are powerful, but without medical oversight, they can also be risky. At Longevity Medical Clinics, we don't believe in shortcuts. We believe in real medicine, real monitoring, and real results. Our GLP-1 weight loss program is personalized to your biology with lab work, ongoing adjustments, and medical professionals guiding you every step of the way. Here's the truth. These medications can suppress appetite and help you lose weight. But if no one's monitoring your heart, your blood sugar, or your overall health, you could be putting your body at risk. That's why we test, track, and fine-tune so your results are safe and sustainable. If you're serious about losing weight and you want to do it the right way, Longevity Medical Clinic is here to help. We combine the power of modern medicine with the confidence of medical oversight, so you can focus on feeling better, stronger, and healthier. Call 866-86-YOUNG or visit lmclinic.com to schedule your free health analysis. Longevity Medical Clinics.
Are you ready to get rid of your reading glasses? Or maybe as you're getting older, and we all are, you just want your vision to be the best it can be. It's time to look into refractive lens exchange at Northwest Vision Institute with Dr. Michael Gilbert. RLE is performed in the same process as cataract surgery. The natural lens is removed and replaced with a high-tech intraocular lens implant. Basically, what that means is your vision will be crystal clear, you'll be able to see far away or up close or both. The difference is incredible. Imagine. No more contact lenses. No more searching for the reading glasses. Most likely, these will be the last lenses you will ever need. RLE is just one of the services offered at Northwest Vision Institute. Come in and see Dr. Michael Gilbert and his team at Northwest Vision Institute. Call 425-450-2020 or online nwvision.com.
It's beginning to look a lot like Christmas everywhere you go. Take a look in the 5 and 10, glistening once again with candy canes and silver lanes.
That
aglow.
voice. Bing Crosby. Love it. Lynette here along with Dr. Samira Umat and Dr. Christine Brazel. And we're taking your calls. We are headed to Covington. We have Gabriel on the line. Hi, Gabriel. Welcome to Leading Edge Medicine.
Hello, Gabriel.
Thank you so much for your show. Really appreciate it. I just wanted to pick your brain a little bit about lymphoma. I mean, I'd like to go the natural way. Is there a natural way, or is it chemo and laser? I mean, I heard of this clinic, an Hoxie Clinic in Tijuana, Mexico. It's been around for decades. Have you heard of anything like that?
You know, unfortunately, I have not. This is one of those things that's far removed from my practice, and so it's not something that I watch for all the time. But tell me a little bit about your lymphoma.
Yeah, they said it's an aggressive lymphoma, and I just had the PET scan done yesterday. So right now it's at stage 1 until they get the readings of the PET scan. Just came out of nowhere. I mean, I came and visited you folks about 4 years ago and did the free test and the $600 blood test. But I didn't do anything at that time. And I was feeling pretty good. I retired, and I've been going to the gym every day, listening to you guys, taking all the supplements that Dr. Mixon recommends. And then all of a sudden I started getting a bulge in my right side of the stomach, and I guess it started metastasizing. I lost 40 pounds. I'm down to 130. I was 170. Wow. And I'm like 6 foot tall. So
wow.
I don't know. I mean, I want
I'm so sorry
whatever
to hear
would
that.
work.
Yeah. How old are you, sir?
I just turned, I'll be 71 in February.
I am so sorry to hear your story. Unfortunately, I don't know of a natural clinic that will treat lymphoma.
So it's best go with the Western medicine then? Is that what you're saying?
You know, that's what I was trained in. That's what I trust. And if you know it is as aggressive as you're saying it is, then yeah, that's what I would do. Would I enhance some of the things with maybe some natural approaches if they did not interfere with anything? So when I have a patient that has cancer, the vast majority of them are also undergoing some therapy with a center of excellence, either the Fred Hutch or another center. And I usually have them discuss with their functional medicine physicians at that facility. Fred Hutch has a very nice one about what supplements and what medications they can take. Because sometimes in chemotherapy, when you're undergoing active treatment, even things like over-the-counter antioxidants are contraindicated. They are actually negating the effect of the chemotherapy that they're trying to give you. And so you have to focus on what is the major task at hand. And if it is cancer therapy, if it is aggressive, if they have a formula that will help suppress the chemotherapy with the cancer with the chemotherapy, then you want to do that first and then be healthy enough to tackle any remnants of the disease that might be left later on. Again, I don't know the details about your type of lymphoma, but I have had a patient with lymphoma that I treated. He joined my practice after he was in remission. He stayed with me until he went overseas for almost a decade or so. And both he and his wife, he remained in remission as long as he was under my care. And he was in constant follow-up checks with the Fred Hutch about his lymphoma. There was no recurrence. He was managed well. He was on testosterone therapy with me, and he received all the usual supplements. But certainly when he first came, I was very apprehensive about what I could and could not give him. And we always checked with the Fred Hutch to make sure they knew about what we were thinking about for him and why we were thinking. And usually they were okay with letting us do what we were doing for other parts of his body. And so that is one success story I can tell you, but he was not in acute disease when he came. He was in remission. We started him very carefully, and we kept him for a very long time. In your case, I'd probably want you to, get the acute situation cleared, be under the care of your oncologist, and then if you're interested, we can help you with some things. But certainly, I would not interfere with that acute care right now.
I'd like to add a little bit to that, to what Dr. Umat was saying. Of course, please get the best care that's available to you, whether through your health insurance with Fred Hutch or Swedish or whatever hospital you're going to be going through, because that's going to be the best diagnostics and the most up-to-date information about what actually works. And that's really going to be specific to you. You said your tumor was aggressive. I don't know more about it other than everyone's lymphoma is a little bit different. And the breakthroughs they're making in therapies are tremendous these days for across the board for so many cancers where life-ending illness can now be cured or maintained in remission for a long time. So don't exclude that right out of the bat saying, I want to do this naturally, because naturally it arose in your body and we don't know why. But I also ask all of my patients who are getting a cancer diagnosis if they are going to do the alternative route, or at least the complementary route, if they don't have access through their hospital like Fred Hutch, is to get a board-certified naturopathic oncologist. It's a different group of people that take years of education and clinically they've been in the cancer hospitals for years, and they're board certified to know what supplements to take, what to avoid, what side effects you're going to experience, how to mitigate it with medication discussion with the oncologist. And there, as Dr. Umat rightly pointed out, if you're taking high doses of antioxidants during radiation, it's not going to work very well, and you want that radiation to work the first time if that's what the treatment is. And the board certified or FABNOs know all of these because they work with the hospital systems. They have access to all the records. They're going to be able to communicate with your oncologist and work out the best plan specific to you. So it's not about excluding it. And I don't know about flying off to Tijuana or anywhere else off the coast of some island somewhere. We can't speak to that. And maybe these things work and maybe they don't, but we'd have no way of knowing if they're safe for you. It might knock out the lymphoma and create another problem. And so, of course, they're not going to be regulated. And, the incentive is enticing emotionally to avoid it. But until they're vetted a little bit more thoroughly, we really don't know what you're going to get. Early days of stem cell therapy caused a lot of problems as well, and now we've figured out how to avoid many of those problems. But it's been, promising for a long time, but they're not always safe. And so alternatives are not always safe, even if they are effective treatments for the lymphoma.
Thank you so much. I appreciate it.
So I'm very sorry to hear about what's going on with you. But again, I think the bottom line is the same. I would go to a center of excellence. I would get the best treatment possible and make sure that if you do want to add some alternatives, every big center of excellence does have that department, and they do work together to find the best alternatives. But I would go get the best treatment that you can possibly get first and get it under remission, and then let's see what happens. Okay, like I said, I've personally taken care of somebody that went into remission and lived a very long and happy life. Okay?
Thanks for calling.
Thank you so much.
Good luck to you, and
yes, we
God bless.
Wish you the best on that, Gabriel.
Yeah.
All right, that was our last caller for the day today. Longevity Medical Clinics. This is where we want you to be. So many of our callers today said they have been patients for some newer patients, a couple of years, some for 26 years. That was our caller that called in earlier, Terry, and has been with us for 26 years. We would love to have you become a patient at Longevity. All you have to do is make that appointment for that health analysis, and we always encourage that blood panel test. What all does that show for us, Dr. Brazel? the big panel?
When people are coming in the health analysis, they get a finger stick test for A1C and an in-body, which talks about body composition, muscle to fat. And that's so important, particularly when people are on the semaglutides, to make sure they're keeping up their body composition so they're not only burning muscle. And that's the complementary component of the visit. And it's the introduction to what long-term health looks like, because very high A1C is associated with so many diseases now, not just diabetes, and very low muscle mass now is associated with rapid progression of aging and onset of many of the chronic diseases, not just osteoporosis, with the muscle and bone mass that happens with the wrong diet or inflammation. And so that's the start of the conversation. But if you proceed to the blood draw, you're going to get a comprehensive panel, as Dr. Umat pointed out, the CBC, a $10 test that can rule out if your fatigue is related to anemia. I have so many patients that develop anemias and their doctors haven't looked, and we're tracking these every quarter, and we see their blood levels declining over a year, and they're not anemic, but there's clearly a problem that's created, and it's very common as we get older. And doctors just can't look at everything. They're not allowed to through the insurance, or that's just too many problems to solve. So just even a basic CMP, comprehensive metabolic panel for kidney and liver function, we're going to do. Am I getting too much protein? Because that's going to show up in your kidney panel. Am I not getting enough? It's going to show up in your kidney panel. So just those two basic tests, but far more with inflammation, vitamins, all the hormones that we talked about, growth hormone, and then the thyroid panel, a little bit more complete than you're going to get through a primary care without having a very bad disease process. And we don't want you to know later you had the disease process when it could have been picked up on labs 10, 20 years before, with the subtle changes that happen with the aging, and the senescence of cells as we age determines how well or poorly this can go for anybody. So then we talk about it a few weeks later with all the results, and you decide you want to become a patient at Longevity, and you pick a program. We have our Platinum program with all that specialty testing we talked about, and our Premier program where we focus mostly on the panels and the hormones and the supplementation.
Wonderful. Thank you, Dr. Brazel. What you need to do to make that appointment is give us a call, 866-86-YOUNG. That's 866-86-YOUNG, or lmclinic.com. You can go there and make your appointment as well for the day, the time that work best for you, and the clinic closest to you, Linwood, Tacoma, or Kirkland. That's our show for the day. You have a great rest of your weekend. We're back next week with Dr. Mixon right here on Leading Edge Medicine.
Seattle Red on 770 KTTH Seattle, 97.3 KIRO FM, HD3 Tacoma, Seattle, 94.5 K233 DT Eastlake, 33 BU